Welcome. Thank you for joining us on today's webinar, hosted by the National Center for Pyramid Model Innovations. My name is Victor Trinidad with NCPMI. This webinar is part of the Within the Framework webinar series and is titled Understanding Trauma-Informed Care in the Pyramid Model, Supporting Resilience. Today's presenters are Chelsea Morris, Amy Hunter, Heather Quinn, and Jade Rodriguez.
Hello, everyone. Nice to have you here with us this afternoon. I'm Amy Hunter, and I work at Georgetown University. And I'm going to have my other colleagues say hello and briefly introduce themselves, and you will be hearing more from them later. Chelsea?
Hi, I'm Dr. Chelsea Morris. I'm an assistant professor at the University of West Georgia in the Literacy and Special Education Department and the faculty director of the Early Learning Center in the College of Education. Jade?
Hello, I'm Jade Rodriguez. I am the program director at Horizons for Homeless Children in Massachusetts.
Hi, I am Heather Quinn. I am the Director of Early Childhood Programs at Martha's Vineyard Community Services, also in Massachusetts.
Thank you so much. I'll tell you just briefly a bit more about me. I did a really short introduction. I am faculty on the NCPMI, the National Center for Pyramid Model Innovations, and I am an assistant professor at Georgetown University. So happy to be with all of you here today and with the esteemed colleagues. You'll hear more from all of them, and in particular, Chelsea and Jade have wonderful examples from their programs of the integration of trauma and pyramid model. But we are going to be talking about trauma today, as well as resilience. And every time we talk about trauma, we are very aware that it's possible that topics may be upsetting, may be triggering. There may be things that come up for you that you might be surprised about or weren't really prepared to be thinking about at this time. And so we just offer some self-care strategies for you. And, pay attention to those feelings, notice how you're feeling, notice if something's coming up for you. Pay attention to your breath. Notice if maybe suddenly your breath is, your heart is beating a little more quickly, or your breath is getting shortened or quick. And if you focus on your breath, that can be very grounding. So actually those deep breaths can really make a big difference in terms of helping you to regulate, which is certainly something we do with children, and helping you to stay calm. Consider jotting down your feelings, making some notes, or even drawing can be helpful. You might want to focus if you're finding yourself getting a little agitated or a little upset, or feelings becoming a bit overwhelming. Notice your surroundings. Notice if you hear any sounds or if it's real quiet. You might notice if there's any smells in your space. Pay attention or notice how your feet feel on the floor, or what your seat feels like in your chair. Those all can be really grounding strategies to keep you in the present moment. Feel free to take a break. As Victor said, we're recording this, so don't hesitate just to step away if you would like to and watch it as a recording at another time. And of course, if you notice things coming up for you, talk to a trusted colleague, friend, family member, therapist. Any of those are wonderful options. We can go to the next slide. So this is the agenda. This is what we're going to be covering today. Our primary goal is to give you an overview of what is in this guide. We have developed a guide related to trauma-informed care and the pyramid model. We'll talk a little bit about message alignment of trauma-informed care and the pyramid model, how these two approaches really overlap quite a bit, and you'll hear some wonderful examples of what that looks like in real life, in real programs from Jade and Heather. And we're going to highlight some of the resources, the guide, as well as a few others. And one thing that's not on the agenda here that I want to emphasize is we want to hear from all of you. So if you hear content that we're sharing with you, or stories that, or examples that Jade or Heather are sharing, Please feel free to ask your questions in the Q&A box, and we will try to answer as many as possible. I'm going to turn it over to Chelsea. Chelsea, tell us about what's in the guide.
Again, I'll reiterate the welcome. We're thrilled to be here today, and we're equally thrilled that the guide is now available for download and use by all of you as practitioners, educators, leaders, administrators. This guide focuses on supporting young children's resilience, better understanding of the pyramid model and trauma-informed care. By engaging with the guide, we hope that you will learn the definition and the prevalence of trauma, that you can dive deeper into how behavior relates to trauma, and really think about in practice how the pyramid model aligns with trauma-informed care. We're also very excited in the creation of 3 appendices that are included in the guide that have very specific suggestions for practice based on your setting and where you are. So first, we wanted to start by visiting a definition of trauma just to set some common language. The guide defines trauma as frightening or harmful events that overwhelm a child's ability to cope or deal with the event or events. Some children experience trauma from ongoing or reoccurring experiences, such as chronic abuse or witnessing domestic violence. However, the guide does a very careful job of recognizing that trauma can also occur as the result of a single event, such as a natural disaster or a car accident. Recognizing that trauma does not exist in a vacuum, it also acknowledges that trauma can be impacting multiple levels of a child's context or setting in which they are developing. So one key component of the guide is information that helps build early childhood educators' understanding about the relationship between trauma and young children's behavior. This includes understanding that children's behavior largely depends on their ability to cope with stress and challenging situations, and that children who have experienced trauma often have difficulty regulating their responses to stressful situations. And this biological stress response may be easily triggered based on past experiences, and that may lead to an increased difficulty in coping with existing challenges, perhaps in your programs or at home or in the community. And so what we're hoping is to hear from Jade and Heather about how they see trauma and behavior interrelated within their own experiences and stories. The guide reminds professionals to remember that behavior resulting from a child feeling unsafe may be that biological stress response to the traumatic experience. And so we will hope to take that lens as we visit some of those stories later in the webinar. So really, the big purpose of the guide was to understand how trauma-informed care approach aligns with, supports, and complements the pyramid model. So to do this, the guide starts by framing a trauma-informed care lens as an approach that shifts from thinking what's wrong with you when we see challenging behavior in young children to thinking what happened to that child instead. We've really pushed this idea, and we also want to make the point, as Jade and Heather will likely mention, that professionals aren't always aware of children's experiences and that they don't really have to be. So equally important here in this webinar, we want to focus trauma-informed care on the question, how can I help? And in this way, we acknowledge that children have this sort of invisible backpack that they bring to our settings, and that this backpack holds beliefs about themselves as children, about the adults who care for them, and about the world around them. We recognize that addressing trauma from a trauma-informed lens often means taking into account a child and family's strengths as well, instead of from a deficit lens. Another really exciting part of the guide is bringing forward some of the existing resources and knowledge about trauma-informed care that are already out there. So the guide presents some critical components such as the 4 Rs, which were written by the Substance Abuse and Mental Health Services Administration. The 4 Rs are the realization about how trauma affects individuals and communities, the ability to recognize trauma, responding to trauma by applying principles of trauma-informed care, and engaging in actions to actively resist re-traumatizing. The guide also highlights 6 key principles. And quickly, I want to define each of these 6 principles because they are the framework for the individual appendices in the guide, which outline specific practices to each of you. So safety is defined as ensuring emotional and physical safety. Trustworthiness and transparency are building and maintaining trust by operating with transparency. Peer support means developing peer relationships, and especially with others who have also experienced trauma. Collaboration and mutuality is defined as making decisions with children and families who have experienced trauma. It's about sharing control and offering choices. Empowerment, voice, and choice means providing an atmosphere where children and families are affirmed and validated, and their voices and opinions are valued and respected. And finally, cultural, historical, and gender issues, which we reframed as equity and culturally responsive practice, recognizes the impact of culture disparity, historical trauma, and equity, as well as actively working towards anti-racism and anti-bias attitudes and practices. So each of those 6 key principles, like I said, are the headers for the individual Appendix C practices, and we hope that you will engage in each one of those. So of course, the broad picture of the guide was to really discuss how the pyramid model and the trauma-informed care approach aligns. We want to take 2 seconds to say that implementing trauma-informed care and the pyramid model is not a new set of skills and practices. It's simply reiterating the importance of both and how they can support each other. This image is actually included in the guide, and in this image you can see that, for example, children who have experienced trauma may need close, secure relationships and safe, predictable environments, which are the 2 elements of the universal tier of the pyramid model. So when you engage with the guide, you'll kind of start to see how these interwoven components of both trauma-informed care and the pyramid are better understood, and that they are not new inventions, and this is not necessarily a new concept. It's simply aligning it in a way that lets us see our approach to trauma experiences of children in a different way. Then this is just the plug of the importance of downloading the guide and using the guide. As I mentioned, the 6 key principles play a large role in each of these 3 appendices. Each appendix is specific to setting. So in other words, there's an organizational approach appendix, as well as one for early intervention and one for the early childhood classroom. Each appendix is set up to provide example strategies for professionals who want to align pyramid model work with the trauma-informed approach. And we hope that each of the principles practices are really actionable on your part, depending on what setting. And many of you will probably see the overlap between multiple appendices that will be useful in your practice. So all of that said, I'm going to turn it back over to Dr. Hunter, who's going to frame our conversation with our guest programs in terms of a lens of resilience.
Thanks, Chelsea. I so appreciate being elevated to doctor, but full disclosure, I'm not a doctor. I'm a social worker. So for all those social workers out there, I have an MSW. So just to be clear, but thank you for that. So let's talk just briefly about resilience before we hear from Jade and Heather. Early childhood professionals play a critical role in supporting children who've experienced trauma. As early childhood professionals, you can ensure at a minimum that children in your care do not become re-traumatized. Early childhood professionals also help buffer the impact of trauma, and most importantly, by supporting young children and their families, you support their resilience. And what we mean by resilience is that ability to recover and adjust to adversity. And sometimes we say the ability to bounce back from adversity, but one of the things, one piece that I learned from someone in a training when we were giving this is they said, I like the idea of bouncing forward. And so not just bouncing back to where you were, but actually by experiencing the trauma, you can actually bounce forward even further. So this idea of enhanced growth. And early childhood professionals can offer supportive environments to help children and families build their resilience. And supportive environments can provide children with a sense of control and predictability, which often results in children feeling both safe and that they can trust the adults around them. So without further ado, I think I would like to go ahead and move forward and have Jade and Heather introduce themselves a little bit more fully than they did at the beginning. And we have a couple of questions. So they're going to introduce themselves. I'll review quickly some of the questions that we have for them. And we will ask them the questions, and we look forward to hearing your questions as well that we can ask them. So Jade, tell us a little bit about yourself.
So I am a program director currently. I have been in this position for 4 years, but I'm always stating the true statement of I'm always a teacher at heart. So I've been a teacher longer than I've been a program director. So I will definitely be speaking from the perspective of a teacher. I have been a preschool teacher, toddler teacher, and even an infant teacher. So I've ran the gamut of working in the different age group. And I've been doing this for 20 plus years. And I was pyramid trained probably more than 7 years ago. But what I've learned then, I still implement even in different settings, even with, believe it or not, my teenager son. So it definitely supports relationship building and among other things that I would love to describe in terms of my experiences in the classroom, combining trauma-informed practices and pyramid.
Great. Thanks so much, Jade. Heather, tell us a little bit about you.
Thank you, Amy. Yes, I am also a director at this point, but much like Jade, really view myself as a teacher. In my current position, I am the director of early childhood programs, and there are 3 programs that I oversee: an early education and care center that serves infants, toddlers, and preschoolers. We also have a home-based Head Start program that works with families of preschool-aged children, as well as a family center. And that program provides individualized supports, parent education, parent support groups, parent-child activities. In my career, I have worked as an infant teacher, a toddler teacher, a preschool teacher, and also I worked for, in early intervention for a long time. That's actually where I started my career. And am incredibly excited to talk with you about the impact that the pyramid model has had on our program and the ways that we've integrated trauma-informed care and the pyramid model into all the work that we do.
Thank you so much, Heather and Jade. And on the next slide, you'll see the questions that we have for Jade and Heather. And we're going to put these questions, I believe, in the chat. And we're going to have an opportunity to hear from Jade and Heather. And again, I want to encourage you to ask any questions that you may have, and we'll ask them those questions as well. So let's switch so that we can see each other. Oh, there we are. Perfect. So I don't know who wants to take this question first, but we're wondering how your program integrates both trauma-informed care and the pyramid model, and how you sort of came about doing that.
So if it's okay, I would love to answer that question. So I work for, and I was a teacher at Horizons for Homeless Children, but with that statement itself, you hear homeless, you're thinking big stressor, big trauma. But in fact, pyramid came about just in essence of trying to understand how to work with the child who's presented in a specific way. So for instance, when I was in the classroom, I would have a lot of transitional issues and not learning how to mitigate that. So when we were trained in pyramid, we learned to use visual cues. We learned to be like detectives. So, so one example that I have that is really profound in the way that I was like, oh yeah, pyramid is the way to go, was when I had this kiddo. I was working as a toddler teacher. Every time that we were getting ready to go outside, he would throw a fit, throw himself on the floor, really would impede all of us from being able to go outside. It took us a while to realize that once he's at that location, he's okay, but it's just getting him there that was an issue. So what we did was we decided to name these areas that we would go to, and then we empowered him by giving him choices, like 2 choices of, after taking the pictures of these locations, to ask him ahead of time, doing the work before we actually start to transition, where he would like to go. So in fact, giving him 2 choices, not to overwhelm him, because we would venture out to any place at any given time. And that was overwhelming for that kiddo, but we didn't know that at the time. So when he would make the choice of where he wanted to go, we would then present it to the large group, and it actually helped transition all the kiddos. So it wasn't just beneficial for him, but it was beneficial for the whole group, which made transition to these areas seamless. So, I mean, there's other things I can also share, but I also want to give Heather opportunity as well, because I love talking about these things.
Well, and before we transition to Heather, because I know you also have ideas about how your program did this or came to this, but I just want to elevate some of the like pieces or themes of what you said, Jade, in terms of what that strategy that you did offered so much predictability for that child who may not, I mean, we don't know exactly, maybe you do know the story, but many teachers don't know the stories of what children and families have experienced. And we don't know the level of predictability in their homes, or, what maybe have, thrown them off because they can't predict things that are happening at home. And so you offered so much in terms of that child feeling more control, feeling more safe, being able to know exactly kind of where they were going and when, and then having even the step further of controlling, making some choices about that. So
Right, exactly. And like Chelsea mentioned earlier, every one of us come in with an invisible backpack, and we're not sure. And before you can even start to implement ideas, you also have to have the foundational of the relationship building. So, you really want to create that protective factor of building that strong relationship with that kiddo. So what does that look like? Seeing him eye to eye, following his lead instead of being directive, just getting to know that child's interests and their habits, all help to support a responsive relationship that can lead you to that. So it's almost like you can't piece apart which is more important. So there's definitely a formula to understanding and building with a child.
great. Thanks, Jade. I can hear your passion as you're talking about this. So Heather, tell us a little bit about your program and how you all integrate pyramid and trauma-informed care.
Absolutely. Much like Jade, I'm always happy to discuss the pyramid model because I really do feel like it's had a transformative impact on our program. I came to my position 4 years ago and pretty quickly realized that we were serving an increasing number of children who'd experienced trauma, really in all 3 of our programs. And I saw that we had incredibly thoughtful and dedicated educators who were working really hard to try to meet the unique needs that each child was presenting with, but we were struggling. And what I realized is we were being reactive instead of preventative, and really began looking for how I could help build capacity within our staff to better understand children's behavior, and was really grateful to come across the pyramid model. And I think for us, the biggest shift has been in how we view behavior. Chelsea talked about that question that we all ask ourselves, rather than saying what's wrong with this child, we ask ourselves, what could have happened to this child? And I think in addition to that, we really view behavior as a form of communication. And we ask ourselves the question, what purpose is this behavior serving? Jade gave some really great examples of some of the challenges that all of us face. Transitions is often one of the most challenging parts of the day for children, and that is because of what both Amy and Jade referenced, the unpredictability that can be involved. So the pyramid model has provided us with really concrete resources and strategies to implement more predictability and consistency into our day so that we can avoid those challenging moments. And then when we find ourselves having a child that's struggling with a particular part of the day, we have the opportunity to really engage in some reflection and ask ourselves, okay, what purpose is this behavior serving? Rather than looking at the child, we look inward and say, what do we need to change in order to more effectively support this child? Typically it's a collaborative approach, teachers talking to one another, and then also one of us talking with the child, and trying to better understand the purpose the behavior is serving, and maybe what strategy we might use to help a child through those difficult moments. Most recently, I can say earlier this week, we were really struggling with the transition from rest, in our case, to outdoors. And we recognized that one particular child who was struggling really benefited from having a focus or a job. And offering her that really eliminated the struggles. But we had to be proactive and preventative in doing that rather than waiting for the big behavior to happen and then reacting.
That's great. You both kind of talked about this question already, but I wonder if that you have anything to add in terms of how you've integrated these two approaches and how it's helped either the children, families, or the teachers themselves. So, how these approaches have helped. If you have any examples or ideas about that.
I would say that it's very helpful because, as Heather said, it takes more than one person. So it can take a team to really come together to collaborate. And as we all know, children come to us with prior knowledge of who they are, and they come along with their parent or parents. So really involving the parent in the work that we're doing with kiddos, especially when their behavior is telling us something. Sometimes the child themselves can't really tell us what is happening, what their needs are. So it's important to incorporate the families. And sometimes the families benefit from being at the table with us to inform us about their child and what they're hoping for their child and what they're seeing, the teacher's input as well. And just the same as at the very bottom of the pyramid, you have staff, the workforce. And it's important for our staff to really know what the objectives are for what we're trying to do here. So really training teachers and informing them before, you just roll out a beautiful pyramid and just say, follow this, because there's a lot more to it than just there's so much pieces and element to it that it's important for all folks to understand. And it might take a while too, because not every situation is gonna have the same resolution. So you might have one child who benefits from choosing, but maybe, it might benefit the child in a different way. So you're constantly like re-looking at what is happening for that child or the classroom sometimes. So maybe it's the way that you have the setup. If you have kids run it, maybe it's, readdressing how you're setting up the classroom. So I'm not sure if I'm getting to the point, but I do feel like it's a continuity of learning and exploring for families, children, and teachers.
I think one thing you're making very clear is that sometimes we glaze over that bottom of the pyramid, and we'll talk about that in a minute as well. But that yellow workforce section is how are we training and supporting and preparing the workforce, which is us and our, the teachers, and to be able to feel knowledgeable, confident, and equipped with all of this amazing theory and strategies and approaches. So thank you for raising that. Heather, how about you?
It's almost hard to begin to articulate how our work with the pyramid model and trauma-informed care has impacted us, because I feel like it's really changed everything that we do. It's provided all of us with an entirely different lens to view our work. And, much like Jade described, we spent a really long time at the bottom of the pyramid, really thinking about what we needed to do to support our workforce. It is not news to anyone on this call that folks who work in early childhood have been undervalued, undercompensated, not had the supports that they need to be successful in their work. So that's really where we spent quite a bit of time, and focusing on relationships between us and the children, relationships between us and parents. Jade described how important it is for us to have partnerships with families. That's true with all families, but becomes incredibly important when you have a child who's presenting with challenging behaviors. And it can be very difficult to develop a partnership with parents, and the strategies that we've learned through the pyramid model and trauma-informed care really has provided us with the language to approach parents in a positive way, so that we're not putting parents in a position where they feel like they're being called out. Rather, it feels like we are reaching out to them because we want to work together to support their child. And really the other piece I can't stress enough is how this work has evolved our relationships with one another. Those of us that work in the classroom together. And that is such an important piece of this puzzle. The work that we do is incredibly rewarding and can be joyful and fun, but wow, it can also be really challenging. And it's essential that we have positive relationships with one another, positive relationships between our administrative team and our teachers. Those of us who are teaching in the classroom need to have opportunities for connection and communication and reflection in order to be sure that we're able to understand the children's needs and have the time to really thoughtfully plan. So again, I do feel like the work that we've done, really, there's not anything that I do that hasn't been impacted by it.
That's amazing. This is a real commercial.
I was going to say, I'm hearing some really amazing clips really from you, both of you, Jade and Heather. And I just want to tie it back to the importance of the guide that really starts with practices in safety, which many of the things you're mentioning, or like in the chat, Renuka, you're bringing up, how nap time can be difficult, but at the core of it, it's about your environment and safety in your environment. So the guide really gives you some of those key things to do. I'm also hearing a lot of that trustworthiness and transparency from both of you in terms of building a relationship with children and with families. And then I love, Heather, that you just brought up the key principle really of peer support, and how important it is that we visit the guide and ourselves in our practice of supporting each other and our colleagues.
Thanks, Chelsea. Thanks for tying it back to the resource that we're highlighting today. I appreciate that. We can't always, we really can't, as much as we would like to, necessarily prevent trauma from happening. Sometimes children come to us and already have had traumatic experiences. However, what we can do is promote resilience. So I wonder if either of you could talk a little bit about either examples or just your thoughts about how your program promotes resilience.
I can speak to that. And I think we just touched upon it. Relationships. I think that, one thing I've really come to understand is that the impact of trauma can be mitigated by positive relationships. And that, includes what I just described: relationships with children, relationships with each other, and relationships with families. Um, and the other piece, once you have that trusting relationship with families and they feel more comfortable opening up to you about some of the challenges that they might be experiencing, it provides you with the opportunity to then connect them with much needed resources. But I think it's really important to remember that that takes time, and that can be hard when you want change to happen quickly. But one of the most valuable lessons that I've learned is that I really need to take the time to develop that trusting relationship with the child, with the parent, in order to get to a place where they're open to participating in conversations with us. I would say the other big piece is creating a supportive environment. That again was an area that we spent a lot of time focusing on. Again, moving from that place of being reactive to being proactive, creating as much predictability and consistency as we possibly can into the context of our day. Jade referenced this. Utilizing a visual schedule, making sure if there are anticipated changes. We're in New England, and sometimes weather might impact our daily schedule. So we have a question mark that we sometimes will add to the schedule if we feel like that weather might disrupt us, and it provides us with the opportunity to support children through those potential bumps in the day. And also really thinking concretely about the environment, that it's really important that children have space. It's a lot for children to be with other children all day. We are a full day, full year program, and I know Jade is as well. That's a lot to ask of children, to be in the context of other children all day. So we've really been thoughtful about creating, what we call alone spots, sort of contained spaces for one, or making sure that we can create small group opportunities within the larger context of our day. Thinking about factors like noise and clutter, which we know can be trauma triggers. We spent a lot of time really looking at our classrooms through the lens of the children that we serve, and made a lot of changes that I think have really impacted, our day-to-day, and certainly helped to build resiliency, not only within our children, but within our families, and also within us as educators.
Heather, you pretty much summarize a lot of this. So, but I would love to add, to also talk about validating feelings. So helping children understand their feelings. So sometimes when we see big feelings, we meaning educators, we ourselves sometimes react to it. So before we even check other folks' the little people's feelings, we have to be sure that we know how we stand. How are we feeling in that moment when we're seeing like these big feelings, or children expressing like some things that could be triggering to us. So Amy, we started this webinar with you actually saying, do you feel grounded? Do you feel your breathing? It's so important for us as educators to also be in that stance constantly. And that's when you really can also lean to your peers to say, I need a moment, or something of that nature. So we're not re-traumatizing that child in whatever that they may be experiencing. So just reassuring and validating their feelings, and that all feelings are okay, even when they seem so big for us. I think it's so incredible for children to build that resilience.
Oh, you both hit on so many wonderful points. I'm taking notes, like, elevate this point or reiterate that point. But the last point you made, Jade, about big feelings and how really big feelings, and I include also really big behaviors sometimes, can promote, like as you said, a reaction in adults. Then we have big feelings and we feel overwhelmed and we feel insecure or we feel unsure or not confident or all of these things. And so to be in tune with what am I experiencing and how can I regulate myself, right? And how can I get myself calm and grounded so that I can make choices about how to respond to what's in front of me versus reacting, and sort of, model and model the regulation, but really even more than that, kind of co-regulate so that the child has that calm presence, to be able to be with. And, it reminds me when you were talking of how scary it can be for children to experience their own big feelings and their own, sort of out of control behaviors. And then depending on how the adult responds, as you mentioned, it could be a potentially re-traumatizing or certainly not helping the situation. So thank you for those. I wonder, Chelsea, do we have any questions that have come up?
We do, and if this is a nice time to fit this in, we have one more planned question, but I think this can take precedent if we run out of time. But one of the participants asks Heather and Jade, to what extent, really, and I'm going to rephrase tiny bit, to what extent is resilience inherent to children? Is it a character, that trait that a child does or doesn't have, versus based on the environment or the systems who develop kind of these protective factors that support the child to develop resilience? So how much of that is kind of a nature versus nurture question?
I love this question. It's one that I have thought a lot about in my work, and I think it goes back to what I spoke about a few minutes ago, and that's relationships, and building a relationship with the child, because every child has strengths. And when we're thinking about building resiliency and helping a child be more successful in the context of life, it's really important that we utilize a strength-based approach. Amy just talked a lot about big feelings and big behaviors. These are words that we use a lot in our work, and it's not uncommon for children who have, those big behaviors, those big feelings, to receive a lot of redirection. And to hear in the pyramid model, it's referred to as withdrawals, as opposed to deposits, getting a lot of withdrawals throughout the day. So one of the strategies that we use, and this is incredibly impactful, is to try and be sure we're using a 5-to-1 ratio, so that for every withdrawal you're making 5 deposits. And I think it sounds really simple, but when you actually start keeping track and being more intentional about it, you can really realize that you're utilizing a lot more withdrawals than you would like. So I think that I absolutely believe that it's possible to build resiliency in all of the children that we serve, but it really does. It takes a lot of intentionality in thinking about, where to begin. And also, Amy just referenced this as well, being really honest with how a child's behavior makes us feel, and developing a reflective practice in our teaching where it's okay to feel what you're feeling and process those feelings, so that when you find yourself in a challenging moment with a child, you have the space that you need to have a more thoughtful response.
And Heather, I would like to add to that. Part of resilience is also teaching and modeling how to have coping skills. So even in those moments when you're feeling frustrated, you can say, I'm feeling so frustrated that, whatever is happening. And so they can see that, there's feelings, and then you can say, I'm going to take a deep breath. I think I need to whatever it is that one would need. So I think, all of that is all behind intentionality. So for me, everything that I try to do in a classroom, I wanted to have some type of learning experience, or I'm trying to model something for a purpose. So I think children definitely are resilient. And as long as they have like Heather said, the environment, predictability, the routine, the follow through. So, if you're a teacher who one day you're allowing folks to play with Play-Doh in the block area, but then another day you're opposed of it, it's very confusing. So to be very consistent so the child knows what to predict. So I think, creating that atmosphere for that child can also inherently have that child be resilient. And to empower the child as well, to given choices. So yeah, I think definitely resilience is a factor in many of the kiddos, even when they go through really difficult times.
Yeah. And one thing we know that the research tells us about resilience is, and you both have hit on this, through this entire conversation, but is the relationships that child has with other people, is people in their lives who care for them unconditionally and who are there in their corner supporting them. And in early childhood, we have an incredible opportunity to provide that for families and for children, to be in their corner, to be supportive, to be responsive, to let them know, as I don't know which one of you said it, but all feelings are okay. It's what we do with those feelings. So those relationships are really critical. And as one of you was talking, I was thinking, sometimes I hear people get frustrated about if a resource might be helpful in a family, it might not be ready, or, that just it may be in a little bit of a struggle with a family. But if a family leaves the program when the program is over with a feeling that I had amazing relationships with teachers and administrators in this program, that's an incredible win. Right. I mean, to be able to take that with them, to then be able to have other, think that they could have other relationships with other providers or school systems after their experience with our program is a really amazing experience to provide children and families. We have another question that I think is probably, maybe we could have put it as number one. And you hit on this, Heather, for sure, and that you probably both did. But this idea of how do we care for ourselves in this work? This work has always been hard work. It's always been underpaid work. That is no, as you said, Heather, no secret. And it's been hard lately in particular for a variety of reasons. But how can we care for ourselves? How can we care for each other? What do you do in your programs to think about this?
As a program director, I ultimately, even though we work with families who's enduring housing instability, I always look at our staff as a potential of being in that same predicament. So whenever we have like extra food or extra anything, I actually offer those things to the staff. And I try to also create an atmosphere that brings safety and predictability, similar to what it is that we're trying to inherently do for our kiddos. And we honor their hour break, paid hour break. We are definitely trying to ensure that we're giving them a livable wage. That's easier said than done, but it's definitely something that is always at the front of anything, because if you can't pay your bills, it's hard for you to really, I'm always, sometimes I play more than one role because I'm listening to a staff talking to me about stressing about this thing or that thing. So really being a listening ear sometimes. You can't fix everything, but really giving them space to be able to bring their whole self to work. Because as much as we like to say, keep your personal at home, that's not really true, because they also have that invisible backpack that you might see it in one person, but others are better at hiding it. So you never know. So I always say, like, for any program to really truly do any trauma-informed practices, they have to start with the staff that they support. So I put great effort in seeing. So I like to say, I see you, you know, because people need to be seen individually. They don't need, not everyone needs everything the same, but you need to individualize as well and give them a voice to talk when things are not going right. Give them the power that they can go to you and say, hey, Jade, like you did this, you did that. So it's always like that relationship building too. If someone comes to me and says, so-and-so did this, did you talk to that person? So we create a climate of understanding like what is expected. So, you know, sometimes it's a misunderstanding. You go back to that person, speak to them. And so definitely have to really support the staff before you can support anyone else, before they can support anyone else.
Thank you, Jade.
Yeah, and I would echo everything that Jade shared. I think there's a lot of parallels between the work that we do with children, with families, with other educators. Creating predictability for educators, I think, is important. Knowing that you have a consistent break at the same time every day, knowing that you have opportunities for self-care throughout the day. I think that when we focus on self-care, sometimes we focus on things that we can do outside of work. And I think it's really important that educators have opportunities to engage in self-care during the workday, and that we're creating space for that. And that folks have regular, consistent, reflective supervision. It's really important to be able to pull back and talk about your successes and your challenges. As Jade said, to have someone who sees you and hears you, that's really important. This work, as I said, can be incredibly rewarding, but incredibly hard. And it's really important to have that acknowledged.
One thing that I learned this year was I kind of overextend myself. It didn't really dawn on me that sometimes doing too much and your employees see that, they also feel compelled to do just as much. So I've learned to stop, not curtail, but just stop all the way from sending email on the weekend. Because when they do get it, they're thinking that my expectation is that they're doing more. So being aware that you're not creating this competitive situation that they feel like they have to overachieve. And that was something that I was like, you know what? I'm gonna implement that because I thought I was doing, you know, it's not bothering me, but me doing too much was kind of like creating an idea that they also need to do just as much.
Yeah. Oh, well, thank you.
I'm sure there's a word to describe that, but
well, one of the things I'm thinking when you're describing that is how containing the boundaries are, right? You know, when you set the boundaries of we're not going to, you know, communicate unless there's an emergency or something, you know, like on work, and the expectation is that you have that time for yourself, you know, and when there are those emails flying, you know, the weekend, no one quite knows, like, am I supposed to respond? Am I not supposed to respond? Is it better if I respond? Am I, you know, it's this unpredictability or uncertainty with that. And so I appreciate your sharing that example. I also appreciate this idea. I think, you know, in these times, so many of us have talked about self-care, and I heard somebody say, I don't want another recommendation for a bubble bath, you know, but this idea of we care for one another, and you're both talking about the system that you create for staff wellness, and you know that you're looking at it at an institutional level or at a level of how do we care for one another? How, as a supervisor, do I let folks know that I see them? I want them to bring their full selves to work, and I want to figure out ways that as a program, you know, we can support that within the program. So I really appreciate those comments. We're close to our hour. I wonder if there's maybe time for one other question. Are there any other questions, Chelsea?
I don't see any other questions right now.
Great. All right. Well, I think we're going to turn it over to Victor for some last remarks related to logistics. But I do just want to thank so much all the participants who logged on and gave us your time and attention. And I want to thank Jade and Chelsea for coming on and sharing your experience. And Chelsea, did I say the wrong name? Heather and Jade and Chelsea. I'm sorry, I'm getting tongue-tied. It feels later in the afternoon than it really is. But thank you all.
All right, thank you so very much to all of you for your wonderful insights today. Your feedback is very important to the work that we do. Please remember to provide your feedback on this webinar with our post-webinar survey by typing the web address shown on this slide into your internet browser. Your certificate of attendance will appear once you submit the survey. We invite you to visit our website, challengingbehavior.org, to sign up for our upcoming webinars, access recordings, download pyramid model resources, and more. Thank you to our funder for making this webinar possible. This concludes our webinar. Thank you all and have a great rest of your day.